So we are discussing about temperament and constitution. So basically we discussed about sanguine temperament, lymphatic temperament. Now we have mixed temperament. Before that, uh, like in Matisse period, there are only two temperaments, sanguine and lymphatic. So there's the reason he no he so there's the reason he explained those theories, but later on their followers researched and they treated number of patients on the basis of the temperament. They got recovery, but some patients have doesn't get full recovery. They got 80%, 70% results. So they studied about their temperament. So basically, they got two more temperament, that is bilious and nervous temperament. Second thing is that, first thing is that, second thing is that they are not separate from sanguine or lymphatic temperament. Okay, they are mixed from sanguine and lymphatic depending upon the dominancy. Okay, so let's discuss all those things. So basically, most of the authors believe that these things. So I want to explain that. So bilious temperament. Who are bilious temperament? Bilious temperament are those persons, they are mixed, again mixed, but their dominance is lymphatic. Lymph dominance is there. Okay, lymph dominance is there. So they are mixed, sanguine plus lymphatic. But if you compare, lymphatic is 70%, 30% is sanguine. Okay, so how can we diagnose those temperament? Let's see all those things now. So basically, uh, the person in this person, the dominancy part is bile in the liver. So basically, liver is a gland. Okay, it releases number of things, substances, chemicals, and end products, and as well as bile for the digestion of all those things, fats and everything, carbohydrates, protein. So basically, liver releases bile juice. So if the person's bile juice is predominance, already you know that lymphatic organ release lymph. So liver is a lymphatic organ, liver is a gland. So it releases one type of fluid that is also, we are comparing with the lymph. So again, but here, other than those names, liver lymph is more dominance. So that's the reason we are giving bilious temperament. So this person is very strong because liver is the main organ in the body. Liver is the factory house of the body. Liver produce number of substances and it metabolize. Okay, so whose liver is predominance, so the person is very, very strong. So let's see the characters. So the person have great muscular activity. Okay, and if you check the pulse, if you check those persons' pulse, it is very strong and it will continue. The strong pulse will continue, same wave. Okay, the wave will does not fall down. The wave does not increase. Okay, and they are their hair color is very dark, dark hair color. So we see number of persons, their hair are dark in color, they are strong muscular. If you check the pulse, they are strong and steady pulse, and the skin is yellowish because of the bile. Okay, and they have strong bones also. Okay, strong bones. So these are most of the person are layman who works daily basis. Okay, the Okay, you can check those person's pulse, their physics, their hair. Okay, uh, irritability, and this is the emotional thing. Okay, they will get more irritability, and they have much more intelligence also. If they uh, believe that they can do anything, if they enter into the uh, study or any field, they will do the work with intelligence. Okay, so this is the very important. And their urine and blood are alkaline in nature. Okay, alkaline in nature, very important because of the bile predominance. Because bile is also alkaline in nature. Okay, we needed it for neutralization in small intestine, and the taste is like bitter taste. They likes bitter taste. Okay, so there are these are the some important hints to discover the patient belongs to bilious temperament, and as well as their digestion is very good. Okay, they work very hard. Okay, they you can do any type of work with them. Okay, and next thing is that the digestion is good, and the digestion whatever they eat, they will it will get metabolized. Okay, so these persons will get liver related issues. Most of the problem are liver related issues, and blood uh, uh, and lymph related issues also this person belong get. So we have to select the remedy. So basically we select S5, not S1 in this person because it is also lymphatic. But here we have to select the main remedy which works on the liver as well as the bile. So we are selecting S5. And other remedies also we will give combination for the bilious persons. So most of the persons who are live in south, they are mostly bilious temperament. Okay, we can saw those persons. They are great muscular. Their intelligence are good. Okay, and their hair color is black. Okay, their bile is predominance. Digestion is also good. They work any type of work. Okay, their intelligence is good. So you can tell that the most of the person, 50 to 60% are belong to south region. Okay. And combination you can give S5, A1, F1. You can give this medications. Okay. This medicines will help to cure the bilious temperamental diseases. Okay, understood. Now we have, but this person, how the person walk. Okay, we'll discuss later. Even he is bilious, even he is nervous, even he is all the mixed. Okay, even the some things are will give hint like walking in the in the lymphatic temperament. The first the person will kept his heel first, then foot. Okay, in the sanguine temperament, the person will keep his foot first, then heel. Okay, and their nose is sharper. Okay, so these are the things which you have to observe. Their talking style and okay, everything you have to notice. Like along with these things, you can easily get which type of temperament of this person is. Okay, so very, very important thing. So those things, these things, comparatively, you have to ask with the patient, ask with the person, and what type of food he eat, how his facial look, how hard these his emotions, mentally, physically, and how he walks, along with these things. So whatever things you will get 70% or 80%. So you have to uh, put those things on those category. If a person have 80% lymphatic signs, okay, you have to do, you have to you have to decide that person belong to lymphatic temperament. Then you have to treat according to that. Okay, you will get wonderful result. But sometimes what happen, the person will belong to lymphatic temperament. As he grows, he will enter into sanguine temperament. Then the diseases starts. Now what you have to do? You have to compare again. Then you will get sanguine temperamental diseases side. Then you select sanguine temperament remedy. So this, like, you have to check all the circular motion. You have to circulate those things and around the patient. Then you will get wonderful results. Now we will talk about nervous temperament. Again, this is in this person, the 70% is sanguine and 30% is lymphatic, or 60% sanguine, or 40% lymphatic, or 80% sanguine, or 20% lymphatic. Okay, nervous, in this, the nerves are predominance. Nerves, brain, nerves, nerve tissues are predominance. Okay, in this person, the most active part is brain and nerves. Okay, in the sanguine temperament, blood making organs. Okay, and lymphatic, lymph making organs are predominance. In the bilious temperament, bile making organ liver is predominance. In the nervous temperament, the nerves and the brains are predominance. Okay, this is very, very important. So here, how he looks, this is very important. Thin hair. This is not this, thin hair. Okay, and clear skin, because the nerves will reach the sense very easily. So that's the reason his skin is fair, clear, and very clear. Muscles are very soft. Okay, this person is very soft. Pale color. Color is pale, and 3D like thread like pulse and frequent. Thread and frequent pulse. Okay, and he's very, very interested to study every time. So you can, this is the one important thing. You can easily ask the patient, is he interested to study? So you can tell this person belong to nervous temperament easily. And emotions are very, very strong. You cannot beat that person in emotions. Okay. He is very attached to everyone. He will think every single word, whatever thing, whatever words are told by anyone. Okay, very, very emotional. Single word he can hurt, and his words also hurtable to others. Some persons in our society are there, they will talk, and it is guaranteed that any person will hurt with their words. But if a person understand that their temperamental is like that, they will talk that much, that types of words only, then we can understand easily. Okay, so the emotions are very, very high. So you can easily understand too, but you remember two things. He is very sturdy person. Okay, and second is emotions are very, very strong, because all thing is activated. Brain is very, very activated. They are only thin, thinner, no muscular things are there. Okay, okay, and they are very sensible person. Okay, whatever things you told them, they will calmly listen, and they want to follow those things, and they observe those things. If they are very much correct, they can easily take those things. Okay, this is very important. So you can easily understand this nerve temperament. Again, I am telling that in this sanguine temperamental is mostly predominance. Okay, but what we are telling, we are telling nervous temperament, not sanguine temperament. So studied sanguine, lymphatic, bilious, nervous. And we have another type of temperament, that is mixed temperament. Any two, it may be sanguine or sanguine or lymph. Okay. But some persons are sanguine, bilious, sanguine, lymphatic, nervous, bilious, nervous, lymphatic, nervous, sanguine. So again, whatever result we get in that we have two or three temperaments are there. So okay, this is a mix. And the nervous temperamental remedies F1 and F2 very important, and you can add as a minute dose. Very important, minute dose. Okay. Okay, so this is about bilious temperament and nervous temperament. So a mixed temperament in that blood or and lymph both are activated. Okay, so he need careful observation. But along other than that, we can easily understood by walking, by talking, by seeing facial expressions, by eating habits, by emotions. All those things you will give information about the person, and you can tally what you studied, then you will get easily what you want. Okay, these are the three steps to understand the uh, temperament. One is the face, the walking style, walk. Okay. Next is facial look. Okay. Third one is eating, and fourth one is emotions, and fifth one is whatever information we gathered, like physical things, hair, eyes, physicals or physics. These five things which are more, you can tally what we studied. Tally. Okay, we tally with what we study, and you will get the result. Okay. So at the beginning, I will tell you that you have to write down all those things. You have to make because temperament is very important in electrophysiology. You will get 100% result if you select the temperamental remedy with the patient. Okay. So what you have to do? How we solve this problem? So basically, you have to note down all those things in one paper. Okay. Then whenever the patient come, you have to check all those things. This is the examination of temperament. You can name examination of temperament in your prescription, and you have to maintain one boxes. I have to take them. Or side, you can write all those things. How his face looks, how he walks. First heel, you can put heel only. And then you can is understood he's putting first heel or he's putting foot. Then face, nose, nose ending and smiling or cheeks. Okay, this will help you. Second. Third, eating habits, ask non-veg, spicy, what is emotions. Okay, ask physical things like hair, how is hair color? It is brown to black or black to brown, or eyes brown to blue or blue to black. You have to ask, okay, hair color, thin, and his how it is looking thick, thin. Okay, you have to ask, and how is muscular. Okay, and what type of eating habits he had. Everything you have to ask, and you have to write down in that box. Then easily you will get those ideas, you will get new ideas, because every person's brain work different, and you will get an idea how to collect the information after doing some homework on temperament. So that idea will help you to easily diagnose the temperament. Okay, so I think you understood about temperament. So this is wonderful study which is given by Dr. Council Metai, which you have to follow to get the results. Okay, so if any doubt, please.